Well, for more on the current state of the pandemic in that province, Minister of Health Dr. John Haggie joins me from Gander, Newfoundland and Labrador. Minister Haggie, welcome to the show.
Welcome, David. Happy New Year.
Happy New Year to you as well. I'd like to start, I guess, with how Newfoundland and Labrador is handling the current COVID-19 situation and get your reaction, if I can, to what your federal counterpart, Health Minister Duclos, said last week when he spoke about the idea of mandatory vaccines as something the provinces might consider in the future. Is that a possibility for Newfoundland and Labrador?
We haven't really discussed that in any specific way at all. It cycles round from time to time, but it's not a discussion we've had internally in any great way. We've looked at it from the point of view of particular workforce members and the Public Service Commission and the regulations are out there looking at, food service workers, healthcare workers and government employees. But a more general mandate, as it were, has not yet really percolated through to the cabinet table.
Is there a way to deal with that last segment of the population, though, that just won't get vaccinated if not mandatory vaccines? I mean, do you up your vaccine passport conditions to the point where it becomes impossible to do things? I mean, how do you go about attacking that last part of the population that you're encouraging to get vaccinated but just won't?
I think it's very difficult. I mean, we've seen our vaccination data for the adults 12 and up. It's really not changed in any significant way since maybe the fall. We're around 93 and a bit percent fully vaccinated and just under 96% with one dose. And that has not shifted. What we are seeing is an uptake in the booster doses, and that's very heartening. Quite honestly, I think where we are at the moment with the VaxPass approach we've taken here is that there is essential activities only for people who do not meet the criteria of fully vaccinated. And I don't know at the moment that I could speak any more broadly than that, because simply we haven't gone down the road of what you do about that last 4%.
You talked about an uptake in booster shots in Newfoundland and Labrador, but I saw there was a protest outside a clinic giving boosters by anti-vaccine protesters that forced the clinic to stop giving shots and forced the police to come in. I mean, how concerned are you about this, and what actions is the government going to take to deal with that?
Well, very concerned. I mean, it's hard really to know where to start. I mean, it's a huge slap in the face for the healthcare workers. They've been at this now for 2 years in one form or another. And to go into that environment and be intimidated, there's no excuse. And I mean, for the people who went there to have their booster and in actual fact, doses 1 and dose 2, because they're eligible for all of that in that clinic. I mean, the irony of it is they wish to exercise their right to consent to have the vaccine. And yet there's people out there frightening them away to say, no, we don't believe that you should exercise that right of choice. It makes no sense to me at all. So I don't really know what more to say than that. From the point of view of what we can do about it, obviously there's an enforcement issue with harassment in the workplace and safety of individuals. And I know my colleague, Minister Hogan in Justice and Public Safety, is looking at a proposal for legislation in the same way we did that to protect people who wish to take advantage of parenthood services and those kind of things. So we have that legislation on the books, but I think he's looking at something that would mirror that to protect vaccination workers and also people who use those clinics, because they have a right to access gold standard acceptable treatment.
Minister, I wonder, though, when you look at the data, it is the unvaccinated that broadly across the country that are filling up the hospital beds, and you do have anti-vaccine protesters disrupting the booster services, and you're now contemplating legislation to deal with that. I wonder what your reaction is when you hear federal politicians saying that we need to find a way to accommodate the unvaccinated, when it is, in fact, when you look at the health capacity crisis happening in the country right now, a lot of it is being fueled and driven by people who simply are refusing to take these vaccines.
Yeah, I mean, we've always had that challenge in medicine. As a clinician, I would encounter patients from time to time who would not accept or acquiesce to consent to a recommended gold standard form of treatment or management. And I think you have to allow them the ability to do that somehow. I think, however, what you need to do is to contain the level of risk that produces to the rest of the population. We don't know in terms of the general population what risk level 4 or 5% of unvaccinated in this province poses to the other 95%. We certainly do know that this has been a wave now and before of the unvaccinated or the incompletely vaccinated. You know, that is a significant challenge, because in taking up those resources cannot then be deployed to people with other conditions who have, you know, legitimate right to expect access to healthcare.
Now, Minister, you yourself, you recently tested positive for COVID-19. How are you doing? How was it, and how are you feeling now?
Well, it's one of the COVID-19 experiences really I would rather have done without. The short answer is it was pretty miserable for a few days, but my wife, myself, and the two dogs got over it. But it's not pleasant, and we were fully vaccinated. So heaven only knows what it's like if it gets any worse. Fortunately, I'm kind of back to normal, and I think the brain fog is gone.
Okay. Well, Minister John Haggie, thank you so much for your time.
Thank you very much, David, and all the best. Thanks for your interest.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.